Hello everyone, my name is Maksym Mamchur and you are on the Healthy Hand channel. I am the co-founder of the network of kinetherapy centers, which is also called Healthy Hand. And today we are going to talk about a rather interesting topic that many of you are familiar with. It's the L5-S1 hernia. I'll tell you how it develops and why the L5-S1 hernia is so well known. What to do about it, how to go on living, and whether it's even possible to go on living at all. So don't switch off, and if you have 1 square meter of space, get it ready, because today I'll be showing you exactly the exercises that will help you forget about your pain. Let's get started. Alright friends, the intervertebral disc. This red part here, that's our disc. These 2 white structures are called vertebrae. The disc, 2 vertebrae. Our disc is made up of 83% water. Where does this water in the disc come from? There are numerous muscles all around our spinal vertebrae. When these muscles work, when they powerfully contract, when they're constantly active and engaged, they effectively pump vital blood everywhere throughout themselves like efficient pumps, nourishing the surrounding tissues. Accordingly, blood delivers microelements to our spine, the necessary amount of water. As a result, our disc maintains its water content at 83%, and it can provide effective cushioning because our intervertebral discs are the shock absorbers of our spine. And when we walk, we absorb shock. Our feet, our joints, and accordingly, the discs in our spine all act as shock absorbers. So the situation is that the muscles in a certain localized area are overstrained, and an L5-S1 hernia is in the lumbar region, which has a very pronounced curve. In the lumbar area, we can bend both forward and backward. That's why the L5-S1 hernia, which is located in the lower back, is the most common type of hernia. And we encounter it very often among all our patients. I think, and most likely, if you're watching this video, then you already know about it. And most often, the muscles in the cervical region, as well as in the lower back, are overstrained. Why? Because we sit a lot, or on the contrary, stand for long periods of time, which leads to compression of these muscles. They contract, compressing all the blood vessels inside them that are supposed to improve the nourishment of our disc. As a result, the amount of water in the disc decreases, and the vertebrae, due to the pressure from our own body, compresses this disc because it is no longer as elastic, it doesn't contain as much water, and this causes what is called a hernia to protrude. The hernia in turn can compress the nerve roots. By the way, it's not necessarily the nerve roots that bother us if there is a hernia. It could be a general inflammatory process that bothers us, or muscle spasms, and so on. That's why today we will be doing exercises that will, first of all, help improve the nutrition of this disc. Secondly, to improve the nutrition of the muscles so that they become more elastic. And so that the compression, the inflammatory process, as well as the rigidity and tightness of these muscles can effectively and completely subside. And accordingly, the entire recovery process can truly begin anew. As a beneficial result, our back will feel exceptionally good and function remarkably well, so that we can live peacefully and not think about that hernia. Because let me remind you, it's not always necessary to operate on a hernia. Let's say in 90–95% of cases, surgery for a hernia is not needed. So let's get started with the exercises. Don't switch off, here we go. The first exercise. We're going to work on squats. I'll teach you how to do them correctly. Why is this necessary? First, squats are about the glutes. The glutes are responsible for our lower back. Why? If the glutes are working properly and their main job is to move the leg back during walking, if they function well, then our lower back doesn't get overstrained. That's the first point. Second, when the glutes are working properly, the amount of nourishment and blood that flows up from the legs toward our lower back increases. That's why it's important for us. And the third element. In the same way, the back of our thigh will also be working, which, among other things, improves the nourishment of the lower part of our back. So watch how I do it and then repeat after me. And accordingly, this will be, at the very least, a prevention of cardiovascular diseases in your case. I have a bed that I will hold on to a little. I keep my back straight. At the same time, I perform a controlled half squat, holding firmly onto the bed with both hands and then slowly rise up. If I can go a bit deeper, I squat a little deeper. Meanwhile, my feet are shoulder width apart. When you don't lean forward, we try to push our hips back as if moving backward. At the same time, I keep my lower back and back straight. 1. When I'm at the level of my feet. 2. When you rise up, you should feel your glutes working. 3 and 4. I gently hold onto the bed a little bit, but I don't push myself off of it at all. Knee. 5, 6 and 7, and the back of the object is clearly and precisely equal to 8 and 9. 10. You who among you can do it? 2-3 sets, you can rest for 30 seconds and repeat the second and third sets. Let's drink some water. Exercise number 2. What do I need? I need to lie on my back. So lying down in this position, first, I pull one leg toward myself, return to the starting position. Pull the other leg in with my hands, stretched it at the end, starting position. Starting position. 2. Starting position. 3. 3. 4. 4. Be sure to exhale. 5. 5. 6. 6. We do this exercise 10-15 repetitions. Similarly, after 30 seconds, you can do a second set and a third set, depending on how you feel. Let's drink some water. Third exercise. I'm lying in the same position. I place one leg over the other on the knees, and on the exhale, lift up. Return to the starting position. 2. At the same time, I should feel my glute. In this position, I should feel how my left glute is stretching. In this position, I should feel my right glute, how it tenses up. We start, for example, if we have persistent pain in the left leg, we typically begin with the left leg, which is positioned on top. And 3 more times. And just a friendly reminder, you can perform 10 to 15 repetitions on each individual leg with 2 to 3 complete sets. Remember to take a brief resting period between sets, typically ranging from 15 to 30 seconds, or at most 60 seconds if you need a slightly longer recovery time. That's enough. Lie down in this position and do the following. Pull one leg towards yourself, using your hands to help at the end. 1. Do the same with the other leg. 2. 3. 3. 4. 4, and make sure to exhale. And 5. I showed 5 repetitions, but for you, it should ideally be between 10 to 15. You can even perform several sets with a 30-second pause in between each set. And the last exercise in this set, sit down in this position. Usually people who have lower back pain find it hard to straighten their legs completely. So we'll start with them slightly bent. What am I doing? With a straight back, I simply reach towards my toes. At the same time, I should feel a stretch in my lower back. Return to the starting position. 2. 3. 4. If I can and feel that my range of motion allows, I start to straighten my legs and do the same thing. 4. I should feel the stretch in the back of my thigh. 5. I'm stretching even more. 6. 7. And if the amplitude of your movement allows, with your legs kept straight and your chest held up, we will try to gently reach our knees. 8. How much amplitude does it allow? 9. At first, this can be a rather painful exercise. We work within our own amplitude, which allows you as much as your body allows. Then we try to increase it each time. More. Do about 15 to 20 repetitions like this, and you can also do several sets. That's enough. Friends, do this set of exercises, and I think that in 3-4 weeks it will become significantly easier for you. If you found this helpful, please let me know in your comments. Let me know how difficult, or on the contrary, how easy the exercises were for you. Subscribe to the channel and give it a like. See you soon.